We are coming to the end of day one here in Arlington, Virginia at the 2024 AMRPA Spring Conference. My name is Adam Robertson. I'm the Senior Marketing Manager of AMRPA, and today I'm sitting with Kelly Linden, President and CEO of Casa Colina. Welcome, Kelly.
Thank you, Adam.
And Dr. Emily Rosario, Director of the Research Institute at Casa Colina. Welcome. Casa Colina is a gold sponsor of our spring conference, so we're, of course, really proud to have them here. Thank you again for your sponsorship.
Proud to be one. Thank you.
So my first question for you two is, what's been going on in Casa Colina's world lately? Any recent achievements that you'd like to highlight?
I'd be happy to. So, as you noted, I'm the CEO and president of the organization. I've just been with Casa Colina for the last year, and we've really had an exciting time. The organization, under the leadership of Dr. Phil Laverso, has done so much over the years and have been proud sponsors and participants in AMRPA for so many years, with Dr. Laverso being one of the founders, I believe. We have spent this past year really thinking about where do we go from here. We've done so much. We're in such a successful position, but what's next, and how do we do that successfully to better serve our patients? So we've been thinking a lot about the things that we do and the things that we do best, which is really focused around rehabilitation and restorative medicine. And yet we have really this full continuum of services, which is somewhat unique to Casa Colina. So we plan to continue to grow and to build on those services. Outpatient therapy, moving out geographically in our communities to better serve our patient populations, our transitional living center for residential needs. We have long-term residential as well, and we're expanding those programs. And we hope to expand our acute rehab offerings as well. So really excited about where we are and where we hope to go. Our board has really supported us in the direction we want to continue to move, advancing care around and support, I should say, of the next generation of providers and caregivers. We have residency programs, fellowship programs, students on the campus, and we'll continue to grow that. But one of the things we're most proud of is our Research Institute and the work that Dr. Emily Rosario and others are doing. We're really excited about continuing to find ways to better serve our patients, to identify problems and opportunities, find solutions, and then bring that back to the patient care and to the bedside. So super excited about where that's going. And I'm hoping that Dr. Rosario will speak a little bit more about that.
Absolutely. Thank you. Exciting things happening in the world of Casa Colina. Dr. Rosario, so let me ask you, from your perspective, what are the most promising developments or innovations that are happening in the world of medical rehab today?
Yes, I think something that is in the research world but also happening in clinical care is the kind of the technologies that are out there, neuromodulation techniques and stuff, which we kind of an accomplishment that we just got a DoD grant to look at focused ultrasound for the thalamus in patients that have had severe traumatic brain injury, which is exciting. Also, like brain-computer interface, I think, is a really exciting technique for individuals with spinal cord injury. So I think, looking at where technologies are at and what they're being tested in the research world, and then taking those back and translating that into clinical care, I think there's a lot of opportunity there right now, which is really exciting.
Looking ahead to the future, how do you see our field evolving?
Yeah, and I think the technology, we just came out of a session talking about AI, which I think, there's some pitfalls there, of course, but I think there's a lot of potential when you look at big data and way to analyze things, looking at algorithms, and I think moving into precision-based medicine, I think is really important. The saying used to be, if you've seen one traumatic brain injury, you've seen one traumatic brain injury, because every injury is slightly different. Right. And I think that remains, but not just for traumatic brain injury, I think for everyone. What are their genetics? What are the environmental factors? What are some of the social determinants of health? There's so many things that go into treating a patient, and so taking all those things together to look at the whole picture, and this is where AI can come in and actually be helpful to find the right intervention or the right treatment for a particular patient to really optimize their outcomes and their care. I think that is where the field is going, and I think there's a lot of potential there to really help to enhance the care that we give.
So exciting things happening in the world of Casa Colina, exciting things happening in our field. We're looking forward to this future. We have things like AI, as you just mentioned, we just came from a session on that. So let's just, I guess, come back to what you were talking about, Kelly. Why AMRPA? Why the spring conference?
Well, AMRPA is so important to our industry and the work that they've done for years in advocacy and education and connection with others who are providing similar care throughout the country. And so this is a tremendous opportunity, one for networking, as I said, two for continued education. But in this particular case of the spring conference and other cases, it's about advocacy and connecting with our congressional leaders and really having a forum. And the voice of AMRPA is so much more powerful than just individually. And yet, as individuals, we need to be participants and really engaging to support our organizations so that we can ensure our long-term success.
Absolutely. Again, the spring conference is all about uniting to elevate our collective voice. We're excited for tomorrow's Capitol Hill visits. Again, this is what the spring conference is all about. So Kelly, Dr. Rosario, thank you for taking the time to speak with me. And again, thank you for Casa Colina's gold sponsorship this year.
Thank you, Adam.